Hello, everybody, and welcome to another episode of the PSS Podcast with myself. I'm Shaun Fowler. As usual, I'm joined by Anita Plant.
Hello, Shaun.
Hello. Nickie.
Hi, Shaun.
And Gary.
Hi, Shaun.
Hi, guys. So, this week we just want to really squash some jargon. So, we get a lot of calls not knowing about, well, there's so many different facets to sight loss and the people you interact with. So, we kind of want to just outline who we are and try and
Who they are.
and who they are as well. Yeah, that's right.
I need to start with
Who is any of us?
what's jargon bashing?
Yeah, that's
jargon
true.
bashing,
What's the definition of a jargon basher?
Yeah.
Well, that's true.
Yeah.
It's busting the novel too.
What's the
Jargon buster.
Bust my own jargon.
average jargon?
First, though, we'd like to say if anybody listening does want us to cover any particular topic, please feel free to reach out to us. You can drop me an email. It's Shaun, SHAUN, at partsite.org.uk. Any suggestions we're happy to take on. And so let's get started, I think. So, Anita, would you like to get started with your vision rehabilitation side?
Okay, so vision rehabilitation officer. So these are people who are there to assess your needs and identify possible solutions to your needs. So basically, what are you struggling with in terms of your vision loss, and what can we do to help you live with that and remain independent? So that might be around skills of daily living, things that you're struggling with in the home. It might involve mobility issues such as training with a long cane. Where I trained, it was called orientation and mobility training, but that is the long white cane training. And also any aids and equipment and so on that are going to help you in terms of your life. In terms of here at the charity, my background is vision rehabilitation as well. So we also include looking at the low vision aids that are going to help you. So magnifiers, lighting, contrast. We bring all of that into that as well.
What other similar job roles would people might get confused with yours, thinking of?
Rehab officer, visual impairment officer. I'm not really sure. As I say, I did my training outside of the country and I was known as an orientation and mobility specialist. Not generally in terms of they are generally employed by the local authority council sensory team. So if you did need help, within your home, they would be the people to contact. So you contact your local visual impairment sensory team, and then they will have a rehab officer who can come out and help you with that.
That's great. So, Nickie, let's move on to you then. So you're our mental health and wellbeing practitioner, but you're also a qualified art therapist.
I am. I suppose the most common thing I get asked about is the difference between a psychotherapist, a psychologist and a psychiatrist. And that can be quite tricky for people to get their head around what might they need for certain aspects of their sort of life and mental health. So just thought it might be helpful to break that down. So if we start sort of with a psychiatrist, this is usually a medically qualified doctor. It's certainly somebody who can, prescribe. They usually have quite a lot of involvement within research as well. They tend to treat sort of more complex mental health conditions. But it really is the fact that they're a doctor. They're at that really high level of clinical qualification.
When you said prescribe, is that medication prescribing?
Yeah. So they can, but they may well prescribe sort of treatments and other therapies, but certainly medication. Psychologists, so that's kind of more the study of people, behaviours and the sorts of thoughts and feelings that might go along with those behaviours. Psychologists don't tend to be medical doctors. They don't all work with patients. They might work in organisations, they might work sort of in more of a wider field. And they may well sort of assess, diagnose and treat if they are working with patients. And then you've got psychotherapists, and they can tend to work with individuals, groups. They use talking therapies quite a lot. There's lots of psychotherapists out there that might be doing sort of CBT, which is cognitive
gonna ask
behavioural
about that,
therapy, sort of arts and play therapies, which obviously falls into kind of more my remit. So I'm an art psychotherapist, so that just means that my specific master's qualification covers me to use, you know, art-based materials and creative sort of interactions with people to kind of assess some of those thoughts and feelings and emotions that they might not necessarily be able to talk about as easily as they could express in some art form. But yeah, I think that's it.
That's great. That's,
For me.
That's definitely cleared
A
out
lot
a bit.
of
Definitely.
ists there,
lot
aren't
of
they?
ists. It's
Actually,
a
that's
minefield.
quite good because I know what Nickie does now.
Yeah. I know.
That's
But
why
we
she
get-
asked me to paint something
Yeah.
the other day.
But we get a lot of feedback that people feel so much better. So you,
Whatever it is,
Something's
hopefully it's
happening.
working.
Fantastic. Well, speaking of ists, we're going to have a lot now as we move to
Oh,
Yeah, there's
area.
quite a few
yeah.
ists in kind of my profession. So I started my career, and it's probably easy to do it that way around, as actually a receptionist in a practice. But I was so bad at filing that they decided that they would send me on to a course to actually become a dispensing optician. So a dispensing optician is one usually it used to have kind of one A level and a few O levels back when I did it, and you couldn't actually then become an optometrist because it was quite different. So a dispensing optician goes to college and they deal with more how to fit glasses, or know about lenses, measurements of that, more physics as well. And once they've qualified as that, they're allowed to fit frames for youngsters or actually people with low vision. If not, they're actually just called an optical assistant, so they don't have that
So-
official qualification.
So they don't do eye tests.
No, they do not. No.
Right.
So they can't do an eye test. So once I'd done the dispensing optician qualification, I quite like the more the clinical aspect of things. So I actually went back to college and became a contact lens optician. They just started dealing more with contact lenses and did that for quite a few years. And then I was quite lucky enough to actually go back. The optometrist course, it used to be quite hard to actually get from a contact lens optician to an optometrist, but they actually had a conversion course. So an optometrist actually does test eyes, but also is qualified to do all the other things that a contact lens optician or a dispensing optician does. So that's why I went and did that. And I've been doing that for about 15 years now, so 40 years in total. So that's the kind of more of a retail outlet. So often people say, what's the difference between an optician and an optometrist? Well, an optician is the place that you go to see an optometrist. So the actual opticians is a bricks and mortar.
Oh, it's a building.
I know.
So when I say I'm going to see my optician, I'm just going to see a
A brick
building.
wall, yeah.
I know.
So you're actually going to see the dispensing optician. And in
There you
fact, back
go.
in the olden days, before the Americanization of it, optometrists were actually called ophthalmic opticians. So they become even more confusing. But once the Americanism came in, all the ists at the end of it, so you get like people that do feet are actually chiropodists. So that's where all of that comes
Actually, you're keeping this quiet because I think you also
from.
did some training as a...
Before I even came into this, I wasn't going to be a chiropodist, but I decided 40 years of looking at feet might not be a good idea.
Yeah, absolutely not.
No disrespect to any
good call.
chiropodist.
No. So that's still something I wish I actually carried on and done it, to be fair. So those are actually more retail side of it. From a hospital element of it, you got ophthalmologist. So an ophthalmologist is a little bit what Nickie said, is that they're more of a doctor. So they're a medic by training. They quite often, well, they do like the first couple of years of normal medic work. So, they look at the entire body. But then quite often they decide, well, actually I quite like the eye side of it. So they become an ophthalmologist. And that's when you see a consultant ophthalmologist at the hospital, and quite often people say they never get to see them again. And that's because that consultant is the one that decides if you need any treatment. They'll decide on the game plan that they're going to use, and then they pass it down to the lower levels, which are housemen, registrars, and junior
Speciality doctors.
speciality doctors. And those eventually are the ones that will become, if you like, consultants. And even within the ophthalmology side of it, you get some ophthalmologists that do surgery. and some that don't do surgery. So there's again quite a mixed bag with that. But as a generic idea, the ophthalmologist is what they call them. So they're obviously, you meet those in hospitals. Very rare do they work in a kind of normal retail opticians. So the other person that you might meet or come across in the hospital is actually an orthoptist. So another ist on the end. An orthoptist work with muscles of the eyes, because there's 6 muscles in each eye. They spent all their day with things like double vision, people that have had strokes, where their eyes are not working as a pair. So that's what an orthoptist is. Yeah, and kind of the last one really would be something like a behavioural optometrist. So they're kind of a little bit more of a specialism, quite often dealing with learning difficulties and how the eyes develop or not develop, as the case may be. And they're actually, again, usually find those more in a retail outlet.
So, Nickie, actually, you'll probably know this coming from the hospital setting. So, within the ophthalmologist, you always get ophthalmologists who specialise in certain parts of the eye. That's right. So, you'd have the AMD.
Yeah, so you'll have medical retina ophthalmologists, you might have a paediatric ophthalmologist, a neuro ophthalmologist, corneal, there will be a specialism. So again, as Gary said, from the medic to then deciding to work within eyes, they then may decide that within eyes, they have a specific interest in a specific part of the eye or condition of the eye, and they'll then, do lots of sort of additional professional trainings towards that. I think it's also important to say as well that within the hospital, even if you've seen that consultant once, and then you see speciality doctors after that, there's always a consultant ophthalmologist sort of who's the overarching umbrella of your care. So you will always be under a consultant if you don't always see that consultant. So it's just important to know that, because I think sometimes that gets lost when people are
quite
kind
often,
of going
actually,
in.
because people do comment to me that I've never seen him or not seen them, and it's kind of, well, if things are going according to plan, that's why you're not seeing them.
Absolutely.
Because, say for instance, it's glaucoma, they'll actually say, right, our formula says that you can't go above 18 pressures, and in which case, if that speciality doctor sees you and it's 22, he'll probably refer you back to the ophthalmologist, just on the basis that it's not quite working as we thought.
Absolutely.
What do you want to do now?
That consultant may have they may dip in and out of that care plan, as the speciality doctor may need it, or registrar. So they are there in the background, still kind of keeping track of what's going on, but you just might not be seeing them.
Okay, so can I just throw in that as well? Because of recent, we are getting more virtual clinics as well. So again, mentioning glaucoma or macular degeneration, people go and have tests done by technicians, and then they go, off you go, and there'll be no discussion as to what's happening with their eyes, and that technician's not actually qualified to discuss that. They're just doing the test.
Absolutely.
But obviously, from a patient point of view, that's kind of a little bit worrying, because they are worried about their eyes, but they're not getting any feedback. But actually, the interesting thing is that consultant or speciality doctor on, say, the Tuesday after you've seen them on the Friday, will actually have a clinic where they don't see anybody, and all they do is look through those tests.
Absolutely.
So actually, they might the benefit of that, unlike a normal clinic where they're rushed or it's really, really busy, is that on that Tuesday, that consultant might look at it and think, not totally convinced, and they'll actually get a colleague in to actually have a look at it. So in fact, you're getting 2 people, but you don't know about it. So although it's less person-centred perhaps from your point of view as a patient, it actually is as good care, if not slightly better, probably, with that as well. Just thought I'd throw that in, because it's one of the questions that I get asked quite a lot, or comments when we get people to see us.
I think in terms of us and our service that we have here, which I think we're quite proud of, aren't we, as a team? We've kind of tried to cover all of those areas. So Gary is our clinical, optometrist. Get my teeth in. I'm very practical solution, centered as a rehabilitation, and Nickie, is helping people deal with that mental health side and the emotional impact of a sight sight loss diagnosis. Sorry, excuse me. And Shaun is also is an
It's the glue that
is
holds it
the
together.
glue that holds it all together. Yeah.
Yeah.
So Shaun's also, you know,
Yeah.
as our communications officer, but also as our tech guru. You know, you're also very practical, aren't you?
What people won't know is actually without Shaun, we wouldn't even know how to work the mics.
Absolutely. So this podcast wouldn't happen without Shaun.
That's
So
right,
yeah, very much a
And
bit
actually,
of a
Shaun is
team effort.
quite often one of the first contacts as well.
Yeah,
so he
you
actually
are,
needs
yeah.
to know a lot about things.
Yeah.
So although he might not have the specialism of all the things that we talked
Yeah.
about, he actually does. You know, he takes a lot of stuff in. So
Yeah, and
That's right.
yeah, and pulls us all in as and when we needed. So
Keep
we're
you
all
busy.
we're all here in the background, but you might phone in and get Shaun. So.
It's unfortunate, but that's true. Yeah. Well, yeah, speaking of getting me on the phones, I think that's a good time to wrap up. So if you want to give us a call about anything you've heard today, if you've got any questions about, if you're confused about the terms that have been thrown at you during your sight loss journey, then yeah, please feel free to give us a call. We're open Monday to Friday, 9:30am to 4pm, and our number is 01302 965 195.
And don't forget to send in your comments or requests for podcasts.
That's absolutely right. Yep. Follow us on Spotify and subscribe to our YouTube as well. Thank you very much, everybody.
Thank you.
Yeah, Anita, Nickie and Gary for joining
thank
us.
you.
Bye.
Bye.
The information provided in this podcast is intended for general knowledge and informational purposes only and does not constitute medical advice. The content is not a substitute for professional medical care, diagnosis or treatment. Always seek the advice of your ophthalmologist or other qualified healthcare provider with any questions you may have regarding a medical condition. Do not disregard professional medical advice or delay in seeking treatment because of something you have heard on this podcast. The Partially Sighted Society does not endorse any specific tests, treatment or procedures, and information provided on this podcast should not be considered as such.